Right, we're so happy to have you here this afternoon with us for Trust for America's Health's Age-Friendly Public Health System monthly training series. We really are working to build the capacity and address how the public health sector can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Cron Phillips. The age-friendly public health systems, or AFPHS movement, would not be possible without the generous support from and partnership with the John A. Hartford Foundation. So we're very thankful and appreciative of their partnership. Next slide, please. So we ask that you all please keep your devices muted during the presentations. Feel free to put your questions in the chat throughout our presentation today, and there will be time at the end for some questions. Next slide, please. So your feedback, your input on these trainings is very important to us. We really want to hear from you. So we are requesting, starting with this training today, that each participant take a few moments to complete an anonymous feedback survey that will appear on your screen at the end of the training. Your insights will be shared with our evaluation partner for the phase 3 of our project, partners at the New York Academy of Medicine. And this will really help us to enhance future training. So it'll be as you see, it's a really short survey, but we really appreciate your response. Next slide, please. So as most of you know, if you've participated in these trainings before, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, Pain in the Nation, which addresses the epidemics of alcohol, drug, and suicide deaths. And related to healthy aging, we publish periodic reports or briefs. The one you see on the screen here is from last year, our Rural Healthy Aging Brief. We have one coming up in the next few weeks, just a little teaser here, and it will look at how the 10 essential public health services are aligned with the AFPHS 6 Cs framework. So I look forward to sharing that with you all. Next slide, please. So this year, in 2024, our trainings will focus on health equity among older adults, with examples and strategies for operationalizing equity in public health practice. Equity, as you can see, is at the center of our 6 Cs framework and is really central to supporting all older adults. And so today's training, we have 2 experts on equity. The work that they're doing is really important. We look forward to hearing from them. So I'm really pleased to be joined today by Kathleen Cameron, who's the Senior Director for Healthy Aging at the National Council on Aging, and Sahar Takshi, an attorney at Justice and Aging. So we're going to start with Kathy, and Kathy, I will turn it over to you.
Great, thank you so much. Well, good afternoon, everyone. I'm really pleased to be with you today to talk about some of the work we're doing at the National Council on Aging related to equity in aging. And I hope some of the examples that I share will provide some ideas for you, inspire you to think about how you can embed equity in all the work that you do in public health. So we can go to the next slide, and I really want to thank Megan and Karen for this opportunity to present to you. So for those of you who might not be familiar with the National Council on Aging, we are a 70-year-old organization dedicated to improving the lives of older adults, especially those who are struggling, those who are most vulnerable. We believe aging well is something that every person deserves, and that the ability to age should not be based on any luck or factor outside of our control, such as gender, color, sexuality, income, and zip code. And our vision is a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. So we can go to the next slide. And we truly believe that aging with dignity shouldn't be just a stroke of luck. And I'll talk about some ways that we help older adults meet that goal. And we can go to the next slide. Just to kind of provide a high-level overview of the work that we do. We develop resources, trusted, unbiased information that enables older adults and their caregivers to take the steps they need that will have a big impact, particularly on their health and their financial security. And we get our information out through our website, of course, social media, and with a large network of community partners across the United States, including some state and local public health departments that we've worked with. And I'll share some examples of how those partnerships have what they look like. We've also developed personalized tools that are available online for free to help individuals find benefits, choose a Medicare plan, prevent falls, manage their money, and so on. And I'll talk about one example of what those tools are. Best practices, we work very closely, again, with a network of community-based organizations, and we provide support, technical assistance to those organizations, particularly around, again, benefits access and health promotion and disease prevention programs. And advocacy, we have a very strong presence on Capitol Hill, and we have a national platform, particularly addressing policy issues that impact the lives of low-income older adults. So we, defend important programs that older adults rely upon. Right now, we're doing a lot of work around Medicare and ensuring that the programs that are available for low-income Medicare beneficiaries, like the Extra Help, the Medicare Savings Program, are going to be available in the future. There's some risk right now that they might not be through the Extenders program. So we're working hard on that. We do a lot of work with the Older Americans Act. We are now focused on the reauthorization of the Older Americans Act, as well as looking at the final regulations that just came out from the Administration for Community Living and how those final regs are going to impact the network of community-based organizations serving older adults, and how they're going to impact the health and financial security of older persons. And next slide, we can go to, we have 4 primary target populations that we focus on. Of course, older adults, but that includes, parents, grandparents, neighbors, friends, etc., anyone living at 55 and over, caregivers, and then professionals, both within the aging network, primarily within the aging network, but we also intersect with healthcare communities as well. And then we work very closely with advocates across the country who want to shape aging policy and influence policymakers. So we can go to the next slide. Okay, and our focus areas are healthy living and financial security. And within our healthy living sphere, we work quite a bit on health promotion, disease prevention, physical health, behavioral health, and Aging Mastery is a program that we developed several years ago to help people live out their best years post-retirement. And then we do a lot of work around financial security, benefits enrollment, job training and employment, retirement, and money management. Next slide. Okay, and this kind of broadly shows how we affect change through our work, directly through individuals, through communities, and broadly through some of our policy and advocacy work through society. So we empower individuals, pursue societal solutions to address market gaps, and then we help to build capacity in communities to address the needs of the most vulnerable older Americans. So we can go to the next slide. We, probably 3 or 4 years ago, created an equity promise that really lays out the foundation for the work and how we, our beliefs related to equity. And this slide kind of, shows what that promise actually is. That, we will demand equity in aging, advocate for change, empower economic security, ensure equitable access to healthcare, listen and act, deploy resources, and then use community-driven and diversity-first approach at every turn. We have made a concerted effort in all the work that we do to focus on key population groups within those over the age of 60, and that is women, particularly low-income women, LGBTQ, older adults living in rural communities, tribal elders, African Americans, and Latinos. And everything we do, we try to measure what we do. And I'll at the end, well, I'm not sure if it's at the end. I think, Karen, you might have my draft slides that you're showing and not my newest one, but that's okay. So you can go to the next slide. Great. And, our work is always through an equity lens, and we really partner intentionally to address the needs of the most vulnerable populations. And, we also walk the walk internally in how our organization is run. So, one example, and I'll share a little bit about this later, is we created an obesity bill of rights. We want obesity to be recognized as a chronic illness, and that for older adults to have access to the full range of treatment strategies for obesity. And we got an op-ed in the Washington Post yesterday talking about our obesity bill of rights. So we can go to the next slide. All right, so this is a slide depicting our social impact. And so what we do, we measure everything we do wherever we can collect the data on the work that we do. And I'll share a little bit in a moment as to how we actually measure some of our work. And we also look at the demographics of the population that we serve. So as you can tell, we are reaching a large percent of low income, older adults, women, people of color, those living in rural communities, and Hispanic and Latinos. So our social impact goal is to reach 40 million older adults to impact their lives in a positive way. And we've been measuring our impact since 2011, and we are currently at about 26 million. So we are a little bit ahead of the game, and we're hoping to surpass our goal again of impacting the lives of the most vulnerable in our country. We can go to the next slide. All right. Well, I wanted to share a little bit about a study that NCOA was involved with a few years ago in partnership with the University of Massachusetts at Boston, where we wanted to really measure the cost burden among older adults of chronic illnesses. And I think you all recognize that older adults have often more than one chronic condition, sometimes up to 3 or 4. And that leads to greater physical limitations, and that many older adults often have fewer financial resources to cope with the high costs associated with those chronic conditions. So the researchers looked at data from the Health and Retirement Study and analyzed almost 12,000 participant survey responses as part of the retirement study. So we can go to the next slide. So in the sample of participants that they studied, almost everyone who was over the age of 60 had at least one chronic condition. And about nearly half of the sample had 2 or 3 chronic conditions. Only 5% had just one, had no chronic conditions. And this slide shows the total costs associated with 5 of the top 10 chronic conditions prevalent among older adults. And again, these costs that the researchers looked at included both the treatment costs, which are here in red, and the green shows lost wages for people who had to leave their job due to health-related concerns, or those who had to maybe take time off because of their health. And as you can see, the lost wages are pretty similar no matter the illness. So about from 10,000 to 14,000 or so. But we really see big differences in the cost of treatment. So Probably not surprising to many of you, a person with Alzheimer's or dementia, the cost of treatment is quite high, almost $34,000 per year, and the cost of the wages is for about $15,000. So for someone with Alzheimer's disease, early stages, it's quite high for them due to both the treatment costs as well as the lost wages. So we can go to the next slide. They also looked at the costliest chronic conditions by race, ethnicity. And the intention here was to demonstrate across the entire US the specific contribution of the most costly chronic diseases by race. And as you can see, cancer was for the Caucasian population the most costly. For African Americans and Hispanic, well, for African Americans, it's diabetes and hypertension. And then for Hispanics, diabetes is the most costly. And I think I will put a link to this study because there's a lot of details in this study that, I won't be going over today, but I think it's important for you all if you're interested in more detail to take a look. We can go to the next slide. Great. The researchers also divided the sample into 4 quartiles of disease cost burden so that the lowest 25% of the sample had the lowest disease cost burden, which was about $7,000, and the highest had the highest disease burden at about $26,000. And once they kind of, took a deeper dive into the data, the disparities across groups really came into sharp focus. And older women came out as being that portion of the population that's struggling the most. And that's one reason why at NCOA we focus on low-income women. Women make up 2 out of 3 adults in the top quartile for the highest yearly cost burden of chronic disease. And of those who lost wages due to chronic illness, over half were older women. Older women also had the highest out-of-pocket medical expenses and the lowest household income. So they're paying more, but they have the least resources to pay those costs. But older women are not the only ones struggling, and we can go to the next slide. Older people of color are also struggling with these costs. On average, older people of color have about $4,000 more in total annual health cost burden than Caucasian counterparts. Older people of color experience about a 15% higher average yearly treatment cost than older white people. And 17% of older whites had lost wages compared to 40% of older adults of color, almost, over double the percentage. So we can go to the next slide, which kind of sums up what this study shows is the cost of chronic disease is more than just it's more than just the cost of medical treatment. It also includes lost wages if an older adult can no longer work due to poor health. And the financial burden of chronic disease is highest for older women and people of color. And individuals experiencing the highest cost burden of chronic disease also have the lowest incomes. And then when factoring both treatment and lost wages, diabetes, cancer, and hypertension are the costliest diseases across all Americans age 60. So just wanted to show this. This was kind of a helpful study for us and relates to some of the work that we're doing. And we can go to the next slide. We do a lot of work around helping older adults, persons with disabilities manage chronic illness, as well as prevent falls and injuries. And we are funded by the Administration for Community Living to lead 2 national resource centers. one focusing on self-management programs and the other on falls prevention. And hopefully some of you might be aware of the work we do in this area. We have a lot of resources on our website to help community-based organizations deliver these programs that are listed here. And there are many more other programs that community organizations, including local departments of health, are implementing around health promotion, disease prevention. We serve as the TA and support center for all the grantees that are funded by the Administration of Community Living through prevention and public health funds to deliver and sustain these evidence-based programs in their communities. And right now we're working with about 60 grantees in 35 states that are either delivering a combination of falls prevention and self-management programs, or they might be just delivering the falls programs or the self-management program. So, I invite you, and I'll put some links in the chat to take a look at some of the resources that we have to get these programs up and running and sustained. But on the next slide, I just wanted to share that we're also working with grantees and community-based organizations to make sure that populations that can most benefit from these programs are getting access to the programs. And we help them to do outreach and advocacy to those populations. And we have resources on our website around outreach strategies. And these are just some of the basic ones that those of you in public health probably use as well, tailoring marketing messages to specific populations. Using technology to improve access to programs through approaches to distribute technology, to get technology in the hands of people, to educate people on how to use the technology, to access programs and information to help them manage their chronic illnesses and other strategies. That was certainly a key part of what we were doing during the pandemic when we had to move from in-person programs to virtual programs. We also work with grantees and others to make sure that they're training leaders who identify with the underserved populations. We want to make sure that, the leaders who are delivering these programs look like and can speak the language of the people who are participating in the programs. And then also, work with organizations so that they partner with other organizations that represent those underserved populations. All right, so just wanted to share that with you. And then on the next slide, great. One of the major areas that we worked on was to increase access to programs for tribal elders. And we developed a report called A Call to Action to Improve Cultural Relevance and Accessibility for Indigenous Elders. And this is a report that we worked on with Indigenous researchers, community leaders, to figure out strategies, short-term, mid-term, and long-term strategies to make sure that Indigenous elders got access to programs that were culturally relevant to them. So I'm not going to go through all of the recommendations here and the actions that we're working on right now, but just wanted you all to be aware of this report, part of which is how do we take these evidence-based programs, say the self-management programs, and adapt them so that they are culturally relevant to tribal elders, so that they will be respected and so that the tribal elders will be respected in these programs, and that their needs are clearly addressed when the programs are delivered. So just wanted to mention that as another kind of equity-based effort that we have been involved in. And I'll put the link to that report in the chat, and we can go to the next slide. As I mentioned earlier, we have been involved in work around obesity and the recognition of obesity as a chronic condition. And we have, with the National Consumers League, we have developed an obesity bill of rights. And we developed this through an obesity and equitable aging roundtable of people with expertise in obesity. We invited representatives from the African American community, Latino, Asian. It was a pretty diverse group of experts who came together to help us develop this Bill of Rights. In addition, we also went out into the communities and talked with older adults at senior centers in Oklahoma, Mississippi, California, and Delaware to help us create this Bill of Rights that we now have launched with the National Consumers League. And here I listed what's in this Bill of Rights. So we're working hard to disseminate the Bill of Rights, get it into the hands of people who can benefit from this. But it addresses things like people with obesity have the right to respect, to make treatment decisions, the right to treatment from qualified healthcare providers to treat obesity, the right to person-centered care, and the right to accessible obesity treatment from healthcare systems, and the right to coverage for treatment options for obesity, including medications that are now available to treat obesity that unfortunately are not covered by Medicare currently. We're working hard to change that so that all Medicare beneficiaries can have access to those treatments. So we can go to the next slide. Also at NCOA, we lead the National Institute for Senior Centers, which is the only kind of national membership organization of senior centers. And we are doing a lot to help senior centers reach out to underserved populations. And one way that we have been doing that is highlighting senior centers that are making strides in that area. And every month we highlight a different senior center from across the country that is really doing some impactful work in reaching underserved populations. So I can also put the link to these spotlight articles, but there are senior centers who are serving, the LGBTQ community, those who are doing intergenerational programs, others that there's a senior center in Texas that we profiled that is supporting HIV positive older adults. We have some senior centers that are working with Department of Labor programs to employ low-income older adults. So doing a lot of work there to, again, really spotlight and spread the information about how other senior centers can make a difference in the lives of older adults. So we can go to the next slide. Oh, okay. And I think I'm probably running out of time, so I will go pretty quickly. Two other initiatives that are equity-based is our COVID-19 and flu vaccine uptake initiative. And we have awarded $44 million to 179 grantees across the country to deliver COVID and flu vaccines. And we particularly focused on serving or funding organizations that are reaching underserved populations, including immigrants, migrant workers, uninsured populations, et cetera. So there are 40 states that have received funding. And over the course of the past year, over 325,000 older adults, people with disabilities, have received COVID and flu vaccines through these grantees. So we're really excited about this initiative and are hoping the funding will continue. It's funded by the Administration for Community Living. And we're hoping we'll have another round of funding for next year. We also support benefits enrollment centers and in which departments of health are also eligible to apply for. But we also focus on finding and awarding grants to organizations that are serving diverse populations. So here's just some details on those grantees. We fund grantees in 39 states, and as you can see, many of them are serving a variety of different populations. So we can go to the next slide. All right, well, that will be it. I'll put a couple of other links in the chat to our benefitscheckup.org, which is a free service to help older adults across the country find out what benefits they're eligible for. And then I also want to invite you all. We are hosting the Older Adult Mental Health Awareness Day Symposium. It's a free virtual event on May 2nd that will address a variety of issues related to older adult mental health conditions, including suicide prevention, substance use, hoarding, and many other topics. And every session includes the voices of older adults. We have a speaker addressing the lived experience. So thank you so much.
Great. Thank you so much, Kathy. If you would like to drop a link to that, to the registration for that event in the chat, I think folks might be really interested in that. So thank you so much for sharing. Really appreciate it. I already have questions for you, but we'll hold those to those to the end.
Yeah.
Sahar, we'll turn to you now and look forward to your presentation as well. Thank you.
Thank you so much. Okay. Hello, everyone. Thank you all for having me today to talk about my program, Justice and Aging, and our more recent work on tribal elders. Next slide, please. So Justice and Aging is a national nonprofit with the mission of using the power of law to fight senior poverty. And we do this in a variety of ways, including systemic litigation, legislative and policy advocacy, as well as research and education. And our work spans across many topics, including healthcare, long-term care, economic security and housing, and elder justice, including guardianships and access to courts. Next slide, please. Okay, so our work at Justice and Aging is centered on advancing equity for older adults, and particularly older adults who belong to one or more marginalized communities. And I'll be talking about that a little more in just a few seconds, but as you'll see on the screen, we have a few core values. We believe that advancing equity should be at the core of all of our programmatic work, all of our external facing work, as well as our internal processes, such as staffing and our board. Next slide, please. So since its inception in 1972, I believe, Justice and Aging has been focused on working to advance or to advocate for marginalized groups of older adults. However, in 2021, we launched our first strategic initiative to advance equity. And so this was kind of a way for us to pivot and really center all the aspects of our work on pursuing equity for older adults of color, older adults with disabilities, older women, older LGBTQ+ individuals, older immigrants, and older people with limited English proficiencies, as well as older adults who live at the intersection of these identities. And as I said earlier, this initiative is about centering equity in all of our work. So as you can maybe sort of see on the graphic on the screen, we've identified ways to center equity not only in our external facing work, like our litigation, our research, our communications, but also our internal facing work, like our staffing, our planning, and our partnerships. Next slide, please. I want to share a few resources that may be of interest to you all. Our network primarily consists of legal and aging services providers, but much like Kathy's organization, we sometimes work with public health and healthcare professionals. Our paths cross frequently. But I want to put some resources out there for you in case you haven't seen them before. The first of them is the Justice and Aging website. And it's linked here, and I think after the presentation, I'll put the link in the chat. But on our website, you can find our educational materials, including our Zoom trainings and webinars, research briefs, and you can also see our some of our advocacy, including like comments to federal agencies on notices of proposed rulemakings. And these span across many topics. Some of the ones that we have under our equity section of the webpage are reentry for older adults who are leaving incarceration, home and community-based services, and we have some things on equity and data and more. Also on our website, you can find our equity toolkit, and we're working to keep that updated with resources, not only from us, but from our partners as well, about advancing equity for older populations. The second resource that I want to point you to is the National Center on Law and Elder Rights. So this is a national resource center that we run through a contract with the Administration for Community Living. And through it, we provide free educational materials like virtual trainings, practice tips, as well as free consultations and technical assistance. If you haven't already, I really encourage you to check out the website. They've been revamping it, so it looks very, nice and flashy now. And I really encourage you to reach out to us about any questions or, issues that you may come across, whether they're legal or about an aging program, or if you're just looking for an example of what other programs or states are doing. And I really encourage you to reach out on equity related topics as well. I think sometimes the National Center on Law and Elder Rights is known for its expertise on the Older Americans Act or Medicaid, but we really do have a lot of resources relating to equity and serving older adults in marginalized communities as well. And if it's not something that we have an answer to or a resource for, we usually have somebody in our network that we can refer you to. Okay, next slide, please. Lastly, in terms of resources, I want to share our equity analysis tool. So this resource is meant to be a sort of framework or guide for thinking about how you can center your work in equity. And it contains a list of questions to consider. You can start asking these questions at the start of a project, throughout the project. I really think it's a recursive process to be thinking about equity in our work. But it's meant to be very flexible, whether you're applying this tool to a legal case, a project, some other kind of effort. And as you look through the questions, you can see how they might get you thinking about how you'll center equity in the way you do your work. So some of the questions include what groups are impacted by a particular action and how are the voices of those impacted communities incorporated into your effort. This resource should also be available on the National Center for Law and Elder Rights website, but I'm also more than happy to email it to you and talk about it further if you have any other questions. Next slide, please. And here briefly is just some of the contact information and the link to the website that I had just mentioned. And I'll give you a second to look at it, and I'll put that in the chat as well. Okay, next slide, please. So I want to talk a little more about a newer area of work within our equity advocacy that I'm super excited about, and that is advancing equity for tribal elders. Next slide, please. In December of last year, we released an issue brief titled Justice for Tribal Elders, and this brief was special for a couple reasons. One is that this is the first time that Justice and Aging has released something specifically about tribal elders, and it's one of our first population-specific efforts. But also because the process of developing this resource, to me, really exemplified how we are framing advancing equity and how we center impacted populations in the way we do our work. Next slide, please. So as we began the process of developing this resource, we were really cognizant about the fact that while we wanted to share information with our national network about how they can better serve tribal elders, Justice and Aging in itself is not a tribal organization, and we don't have staff members who belong to tribes. So our approach was really focused on listening, learning, uplifting, and centering the voices of tribes and specifically tribal elders. One way we did this was through our partnerships. We worked to reimagine some of our existing partnerships, for example, with the National Indian Council on Aging. And we did that to better support the work that they're doing, as well as to ensure that our work aligned with theirs without being duplicative. We also built several new partnerships in the course of developing this paper with national and state level organizations, as well as individual tribal members. The second prong of our approach was listening to tribal elders themselves about the challenges that they faced and the issues that they felt like were a priority in their community, the solutions that they wanted to see or had been working towards and wanted support on. As a national advocacy organization, we are usually one step or more removed from the older adults who actually experience the impact of a policy change or who are consumers of a social service program. So this was a little bit new for us, and we did this by holding a listening session at last year's NCOA conference in Cherokee, North Carolina. And one of our partners, who's a tribal member and works closely on these issues, moderated that session for us. And the session was incredible. We had a packed room, and we had the opportunity to hear stories directly from tribal elders, ask them follow-up questions, and also see all the different perspectives from people across the country in tribes that are situated in different regions and differently resourced. So that experience was immensely, in fact, impactful to the development of the issue brief, in terms of the topics that we uplifted, the language that we use, and how we plan to keep this work going. And the last prong that I mentioned a little earlier as well was this kind of constant recognition of our own limitations and finding where our advocacy would be the most welcome and most useful. Sometimes as professionals, particularly as lawyers, we're really used to being the expert on an issue that we're working on. So it was really important for us to be mindful of the fact that without having that lived experience and without having a direct tie to tribal communities, our expertise was limited. We really wanted to be mindful of not coming into a space, publishing a resource that wasn't informed and directed by tribal elders, or worse, contradicted what the community has been advocating for. And that this was not a one and done deal, but we're keeping those partnerships that we built alive and continuing to find ways to advocate for tribal elders. Next slide, please. So if you have not read the issue brief already, I just want to share a few highlights with you. The first being the topic of tribal sovereignty. So in all of the conversations that we had with our partners, with the tribal elders at our listening session, and all the resources that we found that were directly from tribes, the concept of tribal sovereignty was really emphasized as needing to be at the core of all advocacy. So when you read the brief, you'll see that we not only discuss tribal sovereignty in depth at the start, but we continually uplift that concept of self-determination and self-determination policies and practices throughout the brief. For example, when we're talking about Medicaid or Older Americans Act funding directly to tribes. Next slide, please. You'll also see that we outline several issues to provide a historical background and some cultural context for readers who may not already have that. I believe this is really important in all equity and anti-racist work. And it also came up a lot in our conversations with tribal organizations, this idea that a lot of times people who are not affiliated with a tribe don't have any real understanding of the history, of the culture, of the issues that people living on tribal land specifically are facing. And so really bridging that gap and bringing that information to our aging and legal services network, it was really important to do that in this paper. Next slide, please. And lastly, we focus on several policy areas that are listed here on the screen. I want to emphasize that the issue areas that we included in this paper are not inclusive of all of the issues that impact tribal elders. For example, you'll notice that nutrition and small business is not really included. We made that choice for a couple reasons, mostly because we want to tie the topics that were in the paper to the issue areas that our network of aging and legal services programs work on, so that they can build those connections in their own work of how they can better serve tribal elders in their area, and also to really help them build their own knowledge and capacity of the federal and state programs that they already work with and how there might be different rules or different impacts for tribal elders. So next slide. I believe that is my last slide. Yep. Okay, so the brief itself is available on our website. As I mentioned, I'll put a couple links in the chat. If you have any questions about the brief or anything else I discussed, I really encourage you to reach out to me. My email is here on the screen. And thank you so much for having me.
Great. Thank you, Sahar. Really appreciate all this great information. I've learned so much today. Didn't know about all the resources that both NCOA and Justice and Aging have available. And I'm sure others have learned a lot as well. And so I think we can take the slides down, Karan. And so if anyone has a question for either of our speakers, if you can come off or, open up your camera and please just feel free to ask a question. And we'll give you all a couple of minutes to think about that. And in the meantime, I'm just curious, Kathy, if the financial security portfolio that you all work on, does that also include elder mistreatment? So financial scams, that kind of help. And I guess I have the same question for Sahar, if that's an area that you all work on as well. So Kathy?
We do. We have a lot of resources on educating older adults about what to look for, how to be aware of when scams may be occurring, how to avoid scams. Yeah, on our website, we've done sessions at our conferences on this topic to provide Aging Network professionals information how they can help older adults. And we also, disseminate information from, Social Security Administration, IRS, other federal agencies that are also CMS working on decreasing scams among this population. Yeah, absolutely.
Great. Thank you so much. And Sahar, is this an area that you all work on as well?
It's definitely not one of our primary areas of work, but we do share information, especially from our partners like NCOA and NCEA on, through our network and through our email blasts. And I didn't share that, but through the link to the National Center on Law and Elder Rights, the website, you can sign up to receive our emails, which we share information like that.
Wonderful. Thank you. Okay, questions?
And there was one point that I didn't make during my presentation that I wanted to make, in terms of measuring impact, particularly as it relates to equity. So if any of your organizations are really thinking strategically about what you want to do to make equity a greater part of the work that you do, it's really important from the very beginning to, identify obviously what your goals are, what your objectives are, but how you're going to measure your success over time. And we do that at NCOA, again, through the programs that we help to support across the country. So the grantee work that we do around the health promotion, disease prevention programs, a part of what we do is help them reach their goals in serving older adults and persons with disabilities. And we, all these grantees have to collect data. We manage the national database for these evidence-based programs. And part of the data that they collect includes demographic information. So that's one of the measures that we use for our social impact. That part of that reaching 40 million by 2030. So we measure that. We also measure through our benefits enrollment centers, through our benefits checkup, the number of people we are reaching that are actually getting access to benefits. Yes, we connect people to information about benefits, but we measure those who actually receive a tangible benefit, whether it's Medicare Savings Program, a low-income subsidies under Medicare, or SNAP benefits, or a local, LIHEAP or whatever it may be to help
Mhm.
them. So again, from the beginning, if you're working on this right now in your age-friendly public health, come up with the measurement from the get-go.
Thank you, Kathy. That was actually going to be one of my questions. So I'm glad that you jumped in on that. So I have one other question. The costs of chronic conditions information that you shared, Kathy, I think was really valuable and very impactful for this audience. I'm wondering if that is is that available by state, or is that just the national data that you have?
That was just the national data based on
Okay.
the retirement survey
Mhm.
participants back in, I think it was 2018. We released this study in 2022, but it was kind of the first time that we really took a deep dive into the intersection of health and economic security. And
Mhm.
as I said, it's women and communities of color who are struggling the most with
Yeah.
addressing the
And
costs. Yeah.
I think we probably all could have, thought about that,
Yes,
figured that
yep,
out. I mean, it
yep.
seems kind of like, yeah, okay, that makes sense
Intuitive,
to us.
yeah.
Yeah,
Exactly, yeah.
yeah, great. Thank you. Um, so questions?
Megan, I see one question in the chat.
Okay, yes, I see that too. So Kathy, on slide 12 shows Alzheimer's dementia costs at 46,000, but the last bullet point doesn't include dementia as one of the costliest chronic diseases. So the question is, does NCOA count dementia as a chronic disease?
Yes, we do. Yes, we do. And yeah, there were a couple of different ways in which the data was analyzed. I think on that particular slide, I'd have to go back and look, but I think it was that was costs by race, ethnicity. Yeah, let me follow up on that because yeah.
Sorry.
But we absolutely do, consider dementia, a chronic illness. I think people are living longer with that condition. Yeah.
That was my question. Sorry, I made a typo. It was 48,000. But okay, thank you.
Yeah, I can follow up with you, Kayang.
Yes,
Yeah. Or yeah, it's in the report as well. Yeah.
it's being downloaded now. I can't wait to read it.
Okay. Great.
Great, someone who loves data. Very good.
And I can also put you in touch if you have further questions to our team member who worked on this report from our research and evaluation team.
Awesome. Thank you so much, Kathy. And we always like to offer our speakers, if you have questions for one another, this is certainly a good time to engage as well. But so any other questions?
I guess, Sahar, I would love to connect with you and see where your tribal report kind of, intersects with ours and how we can work together. Ours is really focused on health promotion, disease prevention for tribal levels, but I think there's components of yours that will help us move forward with some of the action steps that came out of our report.
Yes, definitely. Yeah, and we're sort of in the process of planning for, how we'll continue this work in 2024. So I'd love to see where we might be able to collaborate.
That's great. And I would like to connect with both of you as well. We are developing some tools for public health to engage in elder mistreatment prevention, screening tools, just, strategies for working in the community. So would love to connect with both of you as well on any resources you might have to share there. All right, well, thank you all so much. This has been a very rich conversation and lots of wonderful resources. We have captured all of the links that have been provided in the chat, and we will share those along with the recording of this presentation to all who have registered for this session. Karan, I'm going to turn over to you, turn back to you to wrap us up here.
Thank you, Megan. And again, thank you everyone for attending today. Just to give you a preview into the future, our next training will be on March 21st at 3 p.m. and you can register for that under the events section of our website, afphs.org. And you can also actually, a new feature, register for all the trainings this year, which again will focus on equity and different intersections related to that. So if you want to register for one or all, that is an option this year. And if you are pursuing the AFPHS Champion recognition, please take a minute to account for your attendance at this training. If you are viewing this as a recording, please pause the recording now to navigate to the URL or to capture the QR code and navigate to that page to account for that you've attended the training today. And with that, thank you all for attending.
Thanks, everyone. Take care. Thank you, Kathy and Sahar. Very much appreciated.
Thank you.